of the governor's 2-week stay-at-home order. And one of the only things that we're certain of at this point is that situations relative to the COVID-19 virus continue to change rapidly. As a result, I continue to encourage all Gary residents to please practice discipline by staying at home and limiting all travel to only necessary trips. Today I have Dr. Roland Walker with me to share the latest in numbers that have come in from the state relative to positive COVID tests and other results. It's imperative that we continue to give you the most accurate information in an event to keep you updated, but also we want you to understand the seriousness of this particular situation and to respond accordingly. Shortly, you'll hear from Dr. Walker. I want to also share with the Gary residents that our staff continues to monitor the numbers on a daily basis, and we will continue to provide you with periodic updates as the information comes in and as we've been able to determine that it is accurate. Dr. Walker.
Once again, thank you very much, Mayor Prince, for this opportunity to address the public. And I want to say thank you to the public for your cooperation as we're trying to mitigate this virus with social distancing. I think that the public has responded well, and I want to thank everybody. I want to share with you the current numbers as they stand for today in Indiana as well as in Gary, and then tell you what we're doing with these numbers. So currently in Indiana, we've tested over 14,375 people, okay? Of those people, 2,565 have tested positive. Unfortunately, in Indiana, we have experienced 65 deaths. So what does that mean locally? In Lake County, we have had 180 positive tests, and unfortunately, once again, we've seen 6 deaths in Lake County. So in Gary, Indiana, we currently have had 32 positive results in Gary, and so it's the responsibility of our health department. We're doing surveillance, so those people have received phone calls, and we are trying to track down everybody that they've had contact with and recommend that they either get tested if they're symptomatic, or if those people are not symptomatic, then those people are to put themselves into quarantine. We are also monitoring our neighbor county, Porter County, and there are 27 positive cases in Porter County. So the reason why those are important is that we're monitoring those numbers to try and understand what's going to happen here locally in Gary, Indiana, and Lake County. To that end, we are establishing testing at the Gary Health Department. Our goal is to start testing in a drive-up manner by the beginning of next week. We are awaiting a shipment to complete everything and have the testing set up. To that end also, we're looking at other things like screening centers and places in Gary outside of the hospital. So what we're asking today is that if we could have volunteers, so nurses, retired nurses, currently practicing doctors in Indiana or from other states as well, if you would call this number to volunteer, it would be greatly appreciated. So I will give this number now, and that is area code 219-702-7151. I'm going to repeat that number again. That's area code 219-702-7151. Now that number is to our emergency preparedness coordinator, and that person will help to catalog what health professionals that we're going to work with. I will also tell you that we are now in discussion with our federally qualified health centers, as well as IU Med School, as well as the Chicago area Health and Careers Program, who are all willing to work with us to make sure that we can have the health care that we need here. And also let me commend also Methodist Hospital, who's also committed to working with us. So I want to once again thank the mayor for this opportunity to speak to you. Oh, I want to mention one other thing, and that is Methodist has been testing in a drive-by testing at Methodist Hospital North Lake. They continue to do that now, so that is our current one testing center in Gary. It is by doctor's order. So once you have an order for a test, Methodist Hospital will then provide you with the phone number at that time when you have the order, and then you will drive up to Methodist Hospital, a person will come out and test you at your car, and then you will be contacted with results. So that is at Methodist Hospital, Northlake, currently in Gary, and then we're going to add an additional testing site at the Gary Health Department shortly. And once again, thank you very much, Mayor, and thank you very much to citizens of Gary.
Thank you, Dr. Walker. As Dr. Walker was speaking, we actually had one call in from a person that wanted to know, since the city is being shut down or is in the status of being shut down, is there any cleaning going on in the city? I believe the question to ask, and the answer is yes. We have departments such as general services on a call or on-call basis, and any areas that need to be addressed immediately, we're attempting to get to them to the best of our ability. I wanted to also share a little information about our public safety officers, and that is presently we've had no positive tests of our public safety personnel. However, we have had some concerns, and those personnel have been isolated and are being monitored. We have 2 Gary EMTs who've handled a positive patient, and those EMTs are being self-quarantined right now. One has reported minor COVID-19 symptoms, and the other has reported no symptoms at all. We have one paramedic who has displayed COVID-19 symptoms, who's waiting for results as well, and has been quarantined for public safety. We also have one off-duty firefighter who is self-quarantined after possibly being exposed by a relative who has tested positive for the virus. On the Gary Police Department side, we have no officers who've tested positive and no officers at this point who are displaying any COVID-19 symptoms. Our Gary Health Commissioner, as he's noted, is working on establishing more opportunities to test more Gary residents by way of a drive-up testing facility that will be located at the Health Department. So we ask that you continue to be patient and stand by for additional information with that. In addition, we're trying to prepare proactively in the event that the situation continues to escalate or ramp up here locally in an effort to provide additional medical facilities for persons to be treated at, whether it's specifically for COVID-19 or standard or routine medical processes. We're looking at establishing 2 additional sites around the city, as well as working with our federally qualified healthcare centers. We ask very respectfully that you continue to listen in to this channel, call the health department if you have any particular concerns. By all means, if you have a personalized healthcare provider, please contact your healthcare provider with your present status and ask for direction in terms of different approaches that you should be taking. I do have a couple of contact numbers that I'd like to leave you. If you think you may have COVID-19 symptoms, call your healthcare professional immediately. If you have health or medical questions about the COVID-19 virus, contact the Indiana Department of Health hotline at 877-826-0011, or you can visit the website at coronavirus.in.gov. Simply stated, that's coronavirus.in.gov. If you have business or industry-related questions only, you can contact the State of Indiana's Critical Industries Hotline at 877-820-0890, or email questions to covidresponse@iedc.in.gov. Once again, that's covidresponse@iedc.in.gov. In closing, it remains tremendously clear to all of us that it's important that we follow the governor's directives. That being, stay at home as much as possible and limit all travel to only necessary trips. It's also important that you do not form any groups or congregate in groups of 10 or more. Let's face it, no one wants to recognize the worst case scenario, but in times like this, it's always important that we hope for the best and prepare for the worst. And to that end, I believe as an administration, certainly with Dr. Walker and our public safety officers' help, we have done just that in attempting to make sure that the residents of Gary are safe and have adequate information relative to the COVID-19 virus. That's all for now. We look forward to seeing you in a couple days with additional information and updates. Until then, be safe and stay well. Thank you.